What are we doing outside of the front of our building?
We are waiting for our appointment, so we just called and let Leroy know that we are out here waiting, and we need to wait for Leroy to let us in to the building so that we are not waiting with all the other patients for their appointments.
That's right. And normally you get retrieved from your car once you call, and we locked ourselves out. This time we put a doorstop there.
Yeah.
The front door's locked. We come in. What's on the inside?
Here we have our check-in station where we'll take your temperature, screen you for any symptoms, and make sure that your hands are cleansed
36.6.
with our hand sanitizer.
Slightly below normal.
Is
Yeah,
it?
that's about right.
I need Fahrenheit.
Okay, we get touchless hand wash, hand sanitizer. So all the precautions, including on the inside. Of course, we've got our wall of plexiglass, touchless payments, spaced out reception area. So all of our basic precautions for contact precautions are in place. Yeah, can I get a 6-pack of Bud, Marlboro Lights in a box, and give me some of them scratch-offs.
Oh, actually, we only sell PCA and Epion's products here. I'm super sorry.
Okay, but it does look a little bit like kind of the plexiglass at gas station. Is this bulletproof, by the way?
Oh, that's a good question.
Maybe we could ask Julie.
Our COVID deputy.
So that is germ-proof, definitely germ-proof.
Okay.
I'm Julie. I'm a nurse practitioner at Colorado Plastic Surgery. It's my job to keep the patients and the staff safe, COVID-19.
Yes, COVID-19. And what do you got there, Allie?
This is our heightened cleaning protocol checklist. It goes by 30-minute increments, and we are making sure that we're sanitizing every surface, every doorknob, anywhere that a patient or a staff member gets close to on a 30-minute basis.
Thank you.
You're welcome.
On this side, we have our state licensed surgery center, and obviously safety is priority one for all of our patients. We've got extensive protocol in place, starting with what?
Starting with self-isolation before surgery, leading into COVID testing for each surgical patient.
Absolutely. Let's go inside. We can talk about the rest. And like with our practice side, on the surgery side, we're asking patients to have their caretakers stay outside as much as possible, so limited time in our reception area. And then we bring you into the surgery center. COVID is a respiratory virus, and we're used to wearing masks in the operating room. Now we're wearing masks as our patients, both before, during, and after surgery. And we work really closely with anesthesia for all the respiratory precautions in the operating room itself.
Here we are in the operating room, and we're here to tell you about our filtration system.
Why do I feel like we're doing like a film for school or something like that? So yes, the filtration, the ventilation is really important. We're standing together at the operating room table, and for sterility purposes alone, we've got negative pressure ventilation coming from the ceiling down to the corner. There are multiple air exchanges through high efficiency HEPA filtration to keep us safe in the operating room and remove virus, bringing in fresh air. On both sides of our practice, we're actually in two separate buildings. We have multiple HVAC ventilation systems that are completely isolated. The surgery center is isolated, the practice is isolated. Even our treatment rooms for skincare and injectables have their own HVAC system, and the operating rooms themselves have their own system. So we have extensive ventilation, and that really adds to what we do as a staff. We're wearing masks, we limit patient visits, and we really limit the staff. We have staff working from home where possible.
We also are allowed in ancillary services to remove patient masks this week. So we are back in full force doing lip and nose injections as well.
And we fitted for N95 masks, and again, we're in our separate rooms for those treatments.
Correct.